A little bit into trauma. So, trauma expert Dr. Paul Conti defines trauma as an event or a series of events after which there is a negative adaptation in the mind and or body. So, when we think of trauma, this means trauma isn't just a big stressful event by itself or a series of events, but it's the way that the body and the mind adapt negatively afterwards, which can lead to emotional, psychological, and physical consequences. These negative adaptations can manifest as chronic stress, pain, and it's going to affect you over and over and over, right? Trauma memories are usually not processed properly, but they can later be with therapy, okay? This can lead to overgeneralized fear and emotional responses. So what does that mean? That means that if you've had trauma in the past and you've got these unresolved trauma memories, then things that would not normally be stressful to you might appear stressful. Things that might not normally be arousing or scary might become arousing and scary. And so that means that you're getting affected more negatively by those stress hormones and the tension in your back until that trauma is dealt with. So some of the negative adaptations from trauma might be increased anxiety, hypervigilance, avoidance behaviors, procrastination, chronic stress. Physically, you might have chronic pain, such as in your back. You might also have sleep disturbances or other stress-related symptoms. Prolonged activation of the stress response is going to lead to what? Muscle tension. It's going to lead to inflammation, physical symptoms, particularly in areas like the back. So, as you know, trauma triggers the release of stress hormones like cortisol and adrenaline, keeping the body in a heightened state of alert. Trauma leads to stress, stress leads to changes in the brain. Let's look a little bit at that. We talked about the brain rewiring. This ability of your brain to rewire is called neuroplasticity. Chronic stress and trauma can reshape your brain. The amygdala in your brain, the part that senses emotions and triggers a response, can become hyperactive, increasing emotional reactivity, increasing your fear response. By increasing activity in the amygdala, this makes you more sensitive to pain. But it's not just that. Having trauma or having pain over time can lead to problems with your hippocampus. This is the part of your brain that's responsible for memory and learning. When this is impaired, it gets difficult to contextualize past from present, to deal with the situations, to deal with the problem in the now as if it's in the now, and not take problems from the past into the present, not to project things into the future. But it also interferes with your prefrontal cortex. This is where you make your decisions in your brain. This is where we do our problem solving. And it helps with emotional regulation by telling us it's okay, it's actually safe, you can calm down. So reduced activity here, which is what you're going to get as a result of trauma or chronic pain, this can lead to weakened emotional regulation and impaired decision making. Okay. So all of this sounds a bit scary, but don't worry, we're going to help, okay? Emotional stress, though it can reduce the brain's capacity to process pain logically and heighten the experience of pain, the reverse does the reverse. So starting at the brain, processing trauma, dealing with emotions is going to allow you to make better decisions, to process pain better, to feel pain as it's meant to be and lessen that pain, not overreact to it. So trauma leads to stress. Stress leads to changes in the brain. Changes in the brain leads to more pain, but that can be reversed, okay? Pain reprocessing techniques that use neuroplasticity can rewire your brain's response to pain. These are part of the VITA method. If you do the emotional program, it's going to include pain reprocessing techniques that use neuroplasticity to rewire your brain's response to pain so that it feels less, so that your brain's not preoccupied with the sensations in your body. Okay. So what do you need to do? Well, you need an emotional release. That's what you need to do. The VITA method, as well as having the physical movement, which of course helps reduce stress all on its own, separate from what it does for mobility and flexibility and core strengthening, doing any kind of physical exercise or activity is going to help you cope with stress better. But the VITA method also includes meditation, hypnotherapy, neuro-linguistic programming, therapeutic journaling, techniques designed specifically to help you. It's going to help you break that loop. That's where you got to stop. It's the loop between the situation, the back pain, the emotions, the brain. It's going to help you stop by becoming aware of the emotions, by becoming aware of the effect of them on your body and your brain. You're going to be able to intervene and stop that. Now, you might want to do this on your own. That's absolutely okay. You've got somewhere to start now. You might want to do this with a therapist. Brilliant. If you've got severe trauma, then probably you want some one-on-one therapy as well. But a lot of stuff can be processed directly with the Vina method. So it can help you rewire your brain, reclaim your thinking brain, and leave less space for unnecessary pain processing. Now, in my clinic, I've had great success with back pain, with pain management. But Pedro and I, we wanted to go beyond what we do one-on-one, and that is why we're reaching out to you. So if there's somebody you think this can help, then share a video, share a page with them. Remember, back pain is not just physical, it's totally intertwined with your emotional health. So if you understand the root cause, you can reduce or even eliminate your back pain. If you want to get started today, join the Back Pain Relief Hub or go and sign up for a free 14-day challenge. Pass it back to you, Pedro. Thanks for listening, guys.